Hi! Today we're going to be placing a dental dam on Dexter. We're going to be isolating for his 4-6.
To start, we're going to inspect the oral cavity. We're going to look for any lesions, sores, or malapose teeth. And now we are going to floss to check for tight contacts. The clamp size we've chosen is a 12A because we are working on quadrant 4. We've placed a piece of floss as a ligature long enough to facilitate retrieval if necessary. We're going to test the clamp size on the client's tooth to make sure it has the proper fit. At Camosin, we punch wearing overgloves to maintain the chain of asepsis. Depending on the client's teeth, the hole sizes of the punch will vary, however, always increasing in size starting at the anteriors, working your way back to the posterior. Then you'll be ending at the biggest hole for the clamp tooth. For our client, we started with the hole size punch number 2 for his anteriors. We went up to size number 3 for his premolars. Here he had a tooth that was slightly lingual version, so it's off center. We went up to hole size number 4 for his molars, and then we ended with hole size number 5 for the clamp tooth. Applying the clamp, you want to make sure that the bow is to the posterior of the mouth. You also want to make sure the ligature is on the buccal side and hanging out of the client's mouth. When placing the clamp, you want to start with placing the wing on the lingual side and then move on to the buccal side. After applying the clamp, you want to check and make sure there is no tissue impingement and do a little tug test to make sure the clamp is fully secured. When seating the dam, you want to start with the clamp tooth and use the biggest hole. You want to stretch it over the bow and slide it under the wings. Immediately place the dam frame after you place the clamp so the client does not choke on the excess dam. And then you will proceed to seat the rest of the teeth. You will need to place a second ligature on the last seated tooth to hold the rest of the dam in place. You can use a piece of floss or part of the dam depending on your client's contacts. If you use part of the dam, make sure to use a small corner and don't pass the scissors in front of his eyes. For any teeth where the dam has not gone through the contacts, you can gently floss it through. Next, we are going to invert our dam with the beaver tail and air as needed. This will just block out any moisture. Remember to always fulcrum. Note how all the edges are curled over like a turtleneck. You want to do this on the facial and the lingual side. For client comfort, hook the saliva ejector on opposing cheek.
Using the triplex and HVE, clear and dam of any remaining debris. Remove the saliva ejector from the opposing cheek and then proceed to remove the anchor ligatures on the farthest anterior tooth. Place the finger under the dam to protect the client's mouth from the scissors, and then gently proceed to cut the septums between the teeth to remove the dam. Draw a dam through the contacts to the lingual side of the mouth. Remove the clamp, if present, pulling the floss ligature gently, and remove the dam, frame, and tissue from the oral cavity. Check septums against a bright surface to make sure nothing is left in the mouth. If any dam remains in the mouth, Gently floss through. Give the client a fresh tissue, and then give a full mouth rinse to thoroughly rinse and cleanse the area. Give a gentle massage to the gingiva, paying special attention to the area where the clamp was placed.
And then you're going to immediately place the frame so the client doesn't choke on the excess dam.
Remove the saliva ejector from the client's opposing cheek, and then proceed to remove the anchor ligature on the farthest anterior tooth.
You got it. Jade. I can't get it out.